Fiber optic endoscopy is a valuable tool in diagnosis and treatment of various disorders of stomach, esophagus, and intestine. During endoscopy, a high-resolution video camera mounted on the tip of a flexible hose, which is the size of a pen, is introduced in the mouth or rectum and advanced gently while looking at the pictures on a high-resolution monitor in real time. This procedure is typically performed under sedation, administered for patients' comfort. Sedation means that patients don't feel, see, or hear anything but are breathing on their own. Before the endoscopy, patients may be required to fast for up to 8 hours and, in some cases, may need to take laxatives to clean the intestines. During the procedure, a physician is able to detect such abnormalities as ulcers, polyps, tumors, strictures, blockages, and inflammation. We can also take a small tissue samples called biopsies, which can be analyzed later by microscopy to find bacteria, cancer, and other problems. Today, endoscopy is increasingly used to not only diagnose certain problems, but also to treat them. There are various tools available now to deal with multiple diseases of gastrointestinal tract. We can remove small polyps and tumors from the stomach and intestines, enlarge strictured areas, and close fistulas, all using the endoscope as a tool. The endoscopy is especially valuable in the field of weight loss or bariatric surgery. We routinely utilize endoscopy to evaluate patients' stomach, esophagus, and intestine before weight loss procedures to detect conditions which can make certain types of weight loss surgery less safe. During procedures of gastric sleeve and gastric bypass, endoscopy is used to test for leaks or blockages. After weight loss surgery, we use endoscopy to evaluate causes of weight gain, abdominal pain, or reflux. Endoscopy is a minimally invasive intervention, but it is a procedure, so certain complications are possible and can occur even in the most experienced hands. Before endoscopy, if sedation is planned, patients may need to undergo medical clearance to make sure sedation can be administered safely. In my endoscopy procedures, sedation is always administered and monitored by an anesthesiologist, a physician specifically trained in the field of sedation. During endoscopic procedure, an injury to a gastrointestinal tract can occur. The risks of injury can be higher if an interventional surgery was performed, such as dilatation of the stricture or revision of the gastric bypass. If patients have pain in the abdomen or chest after endoscopy, they should contact us immediately. Endoscopic procedures to evaluate the stomach and parts of upper intestine generally take about 10 to 15 minutes. Colonoscopy can take about 45 minutes. Endoscopy is typically performed in an outpatient facility. Recovery from sedation is usually 20 to 30 minutes, but some patients may be monitored for 1 hour after the sedation. Because sedation can cause impairment for up to 24 hours, patients are advised not to drive or make any legal decisions immediately after the procedure. If you have any questions about endoscopic procedures, please don't hesitate to contact our office. Thank you.